The first thing that I would like to know is what exactly is hypertension and what are the what triggers hypertension in people?
That's a wonderful question. Hypertension is, as the name implies, hyper and tension. So obviously it starts with tension, stress, and then it becomes a persistent increase in blood pressure, which does not come down on its own. Normally, the mind is there to actually respond to stressful situations that would lead to increase in pressures when it is a time of need. But if it persistently remains high above 135 and 85 is supposedly high normal, and 140 and 85 above that, if it is there, then it's called as hypertension persistently. That means if, say, for example, I give you a sort of a story that if a person comes to me for a checkup and I find the blood pressure to be 140 by maybe 85, I would not rank that as hypertension on the first visit. It has to be a consistent, persistent increase in pressures. That is point number one. And the second part is equally important. What brings hypertension? The hypertension is a thing which actually have two components. One component is genetic component. That means we bring it from our parents. So for example, if a person has a family history, the parents, father, mother, or maternal uncles and paternal uncles would have increased pressures at a younger age and persistent hypertension, they would have a high likelihood of having hypertension down the life in their livelihood. So that is a genetic factor. And there are many genes, about 50 odd genes, which have been actually worked upon to actually associate with hypertension. But that is something which we cannot control. However, there are environmental factors which are very important for us. And that is one of the things why we call hypertension as a lifestyle disease. Lack of exercise, the first and foremost, obesity, having diabetes along with it, and the other thing is heavily indulging into salty diet, leading to obesity and hypertension, and smoking, alcohol, sometimes drug intakes, specifically, say, for example, steroids or non-steroidal anti-inflammatory agents, the painkillers, which we commonly call, they are very commonly associated with hypertension. And so these are important things. So I would like to say that genetic predisposition is one thing. Unfortunately, we cannot change it. But what we can change is our lifestyle. And that is something which is important factor for development of hypertension.
Exactly. So which age group is more vulnerable to hypertension?
Important question. It's not a single age group, but they say that as age advances, each passing decade increases the risk of hypertension. And that is obvious because with passing age, the stress levels go up, their arteries, the blood vessels of the body actually becomes rigid and stiffer, and their hormones level, the kidneys, everything get to the other edge. So they say that as the age advances, the proportion of people with hypertension increases. And I would say we call anybody above 18 years as adult. So after adulthood, specifically if you have a family history of hypertension, you should get yourself checked for blood pressure. Because one thing which I would like to add here, many of the people have a false sense of security because they don't have symptoms. Unfortunately, hypertension is supposedly a silent killer. It does not produce any symptoms. Agitatedness, headaches, blurring of visions, and all those things, they are signs of extreme hypertension, not mild hypertension. So mild hypertension is unusually very rare to be detected because of symptoms. You don't have symptoms of hypertension. So you have to be proactive in checking your blood pressure time and again, and keeping it in check and detecting when the hypertension is beyond limit of just lifestyle control.
Right. Since you said that there are no symptoms that one can look out for, then how do I know that I have hypertension? How do one get? Yeah.
Wonderful. So this is precisely what I tried to add. So if you have a stressful situation, you are not able to sleep properly, and you have obesity, and you have other risk factors such as smoking. So at a certain point in time, you should have a habit of checking your blood pressure once in a while, maybe once in a year at least. just to make sure that you are not going beyond your limits. Secondly, if you have a family history of hypertension, then it should be much more regular. Even if you don't have any stressful factors, your sleep pattern is okay, still you should get yourself tested for your blood pressure after 18 years of age, at least once a year, and just to make sure that you are not building up these signs and the disease of hypertension. Commonly understood symptoms of hypertension as headaches and irritability. I would say that this is a myth, because irritability is not the cause of blood pressure. Rather, it has a common source. What is causing you irritated is also increasing your blood pressure. So that is a stress, actually. The second thing is headaches. Headaches were commonly understood to be because of hypertension. Again, headaches are a sign of stress. If you don't have a good night's sleep, the stress level is increasing your blood pressure as well as causing a headache. So that was a very good study, where they did ambulatory BP monitoring, measuring their blood pressure 24/7. And they measured the blood pressure and found that when they recorded headaches, the blood pressure was X. But when they did not record headaches, the blood pressure was even higher. So there was no relationship between headaches and their blood pressure readings and all. So that is why it's a common myth.
Right. If I'm reading, if I'm considering hypertension, like there are no symptoms and still I can, so when I'm reading the BP, how much is too much? When should I be worried about it?
So the readings, they are very classically defined. If your doctor measures your blood pressure and it is above 140 millimeters, the upper reading, systolic what we call, and the diastolic reading above 85 at any point of time, this is a person with hypertension. But as I said, it should be regularly so. That means at an interval of 1 to 2 weeks, 2 or 3 readings consistently above 140 and 85, 90 should be considered as a hypertension. And we rank that as a mild hypertension because that is something which we may not necessarily require treatment unless the person is at high risk. However, if a person has a blood pressure of 180, the upper reading, and lower reading above 110, that reading is too much. It's extreme blood pressure and should be managed immediately. We should not wait for the readings to actually injure the body. So that is something, there are various ranks. Every 10 degrees increase, say for example, 140 to 150 is mild, 150 to 160 is moderate, and grade 2 hypertension is above 160 millimeters of mercury. Same way, 90 to 100, 100, 110, and 110 abovewards is in that particular category. So that is why mild, grade 1 and grade 2 hypertension is what we talk about.
Okay. Are there any types of hypertension that you would like to share with us?
So the commonest cause of hypertension is, as I said, stress-induced, where there is no exact reason, maybe some genetic factors, and we call it idiopathic. In adulthood, maybe 85 to 90% people would have this kind of hypertension. And we call that primary hypertension because it's basically the etiology is not known, and that is why it is called as primary hypertension. But there are other causes where certain organs, specifically the hormone releasing organs, actually get defective, and that leads to extreme hypertension, and we call that secondary. That means the defect lies in a particular organ, which has led to hypertension. That is why it is a secondary effect. The commonest of them is the kidneys, maybe renal artery stenosis or kidney damage or kidney injury because of diabetes or whatever reasons, that can lead to hypertension. Some other renal pathologies could be there. Nephritis or glomerulonephritis can also cause this thing. Renal tumors can cause it. So that is the commonest cause of secondary hypertension. The other causes are, for example, hyperthyroidism, or certain other hormones, pituitary adenomas and other things can cause hypertension. Sympathetic stimulation, the adrenal gland, again, is a hormonal gland which releases the stress hormones, adrenaline, noradrenaline. If that organ is overactive, then also hypertension can happen, pheochromocytoma, what we call. And there are certain neurogenic causes of hypertension. So there are a lot of other causes of hypertension. We club them into secondary causes of hypertension. The differentiating feature is primary hypertension is slow, gradual, slowly upwards trends. Whereas secondary hypertension can happen in extreme of ages, say, for example, in children or in a very high adult group where there was no hypertension earlier. Suddenly hypertension develops, then we should suspect secondary hypertension. Usually the blood pressure is very high, as I said, 180 and 110 onwards. And usually there are complications of hypertension. That means either the vision problems or neurological issues, strokes, or even myocardial infarctions can happen because of these things, or secondary injury to the kidneys can happen. So that is why secondary hypertension is more dangerous, but more prevalent is primary hypertension, or milder, what we call essential hypertension.
Okay. So can hypertension also lead to a heart attack?
Yes, it can. Rather, in one of these studies, nearly 1/4 of the heart attacks were because of precipitation through hypertension. Why? Because when you have an emotional outburst, for example, some person in the family or some struggle or something, you push yourself too much, and that leads to the flow into the arteries of the heart to be very turbulent, which leads to injury into the arteries and thrombosis. So hypertension is definitely a very common precipitator of heart attacks.
Okay.
Especially the surges, the emotional outbursts and other things.
Stress, mainly the stress or your emotional stress level, that actually triggers hypertension more. That you.
Yes.
Okay.
Yes.
People believe that hypertension is non-curable. Is it true?
Yes and no, because what is the defect is certain things which are very difficult to treat. For example, the lifestyle, as I said, if you don't have any precipitator, in today's world, you are living on stress, right? We are all driven by corporate culture. And what corporate culture, unfortunately, this is a bitter truth, is just like a donkey with a carrot in front of it. You have new targets, revised targets. The day you achieve targets, there is new target given to you. You are never out of stress. Rather, you are paid to take stress. A person in my corporate, if a person is saying that I won't take stress, I would just work this much. The promotions, everything is dependent on the stress you take. So unfortunately, in this competitive world, we are living on stress. So that is something which is a bitter truth. And that is why taking care of stress, it's more theoretical than practical. These yogas, meditations, I agree, there are a lot of exercises, the Sudarshan Kriyas and the yogas and meditations. But how long can you do it? Do you stop working just doing yogas and meditation? So actually, it's very difficult art to inculcate the culture of yoga and transcendental meditation in you so that you can use that when the stress level is high. But usually that is just like that Mahabharata stories of Karan, the Karan. He forgot every art of his when there was a problem at his hand. That is what happens when the stress is there. You forget to use those transcendental meditation and other things at the time of stress. Once who does that, he can actually calm himself down. The second thing is creating exercise pattern in your life. Regular 150 minutes of exercise every week is something which is known to reduce hypertension. The diet should be in only proportion to what you can burn. It's just like a car refueled by petrol. You can only refuel your petrol into your car what you burn. If your car is standing in the garage, you don't have to refuel it that much more often. But today's culture is we are eating, drinking, and meeting, all the meetings. Fortunately, with COVID, the good thing is that we are working from home and we are able to govern our lifestyles. But in most of the meetings, you are eating as well. Meetings are converted into eatings. So that is something, unfortunately, eating becomes a status symbol, not a health symbol. And that is why high salt items and all those trans fats and other things which are leading to the lifestyle disease of hypertension and coronary artery disease. Smoking and alcohol, it's something which has to be given up. So these 5 things, 5 vices, I would say, the alcohol and smoking, the regular exercise, lack of exercise, I would say, stress, and the diet. If a person controls these 5 things in regulation on regular basis, that's curable. The 85% of people can get cured. Why? Because they have prevented from the hypertension to increase. But unfortunately, in today's world, if you do all those 5 things, you are more of a yogi than a human being, right? Regular exercise, diet control, frugal eating. Well, I believe that if a person indulges into all those 5 activities, regular exercise, diet control, smoking and alcohol cessation, and the diet in salt restriction, the person would definitely be able to cure this disease to a large extent, specifically when it is early and when the reason for hypertension is more stress rather than the secondary causes.
Right. So still you are stressing a lot on diet. Any particular diet that a hypertension patient should follow to lower down the symptoms?
Yeah, I think there are a lot of diets. Many that the DASH diet has been supposed to DASH. DASH diet has been supposedly the best recommended diet for control of hypertension. But let me give you the basic principles. The sodium level in your diet should be restricted. And sodium comes from salt, sodium chloride. Average Indian diet contains almost double of that. Why? Because the salt is the commonest taste maker. When you eat out, the salt content in your diet is not in your control. So home cooked food where you can control your sodium content can help your diet. The second thing is the potassium. Potassium is antihypertensive. So if you take a lot of potassium in your diet, that means in the form of fruits, high fruit quotient on your diet. Also, sometimes the natural salts, instead of the polished salt, the natural salt contains more of non-sodium salts. That means potassium salts and magnesium salts and calcium salts, sandhanamak and all those things. So they supposedly are better for control of hypertension. That is why. And very high in fiber. So that means your weight is controlled with that. And your potassium diet should be more, and your sodium content of the diet should be less. These are the 3 principles of your diet. Otherwise, you can follow the DASH diet and other things. There are so many recommendations, but the principles are these 3.
Okay.